As a cannabis patient, you are in control of your medicine, and this includes your dosing. Now, I know this can be overwhelming, especially if you're coming to cannabis as a brand new patient, transitioning from a typical pharmaceutical world where we're given a prescription, told to take it how many times a day, and good luck, see you later. Cannabis is the complete opposite of that. It's so different, but it's what makes it magical. It's what allows patients to get so much relief and the best benefit. You get to choose what you take, when you take it, based off of what works best for you and what your priorities are in that given moment. So figuring out your perfect dose, your sweet spot, or your optimal dose is everything to becoming a cannabis patient. So there is one golden rule that you have to remember when it comes to cannabis dosing. Low and slow is the way to go. Low and slow is the way to go. I could sit here and say this 15 times over, and there's always going to be a patient that doesn't listen. I cannot stress it enough. Low and slow is the way to go. Cannabis is not about just overloading your system and taking as much as you can. It's about balancing your endocannabinoid system, and everybody is going to need a different amount. It's about finding your personal sweet spot. As you become used to cannabis, you will slowly increase your dose over time, and you'll figure out that sweet spot. If you actually take too much cannabis, you'll probably just feel a bit off, maybe a bit uncomfortable. That's a good thing. That means you know where your sweet spot is, right below where you just were. So take some time to slowly work through, increase your dosages to find that sweet spot. Now, the best way to do this is typically every 3 days or so, slowly increase that dose. Now, what that looks like is going to depend on the product that you're taking. If you're doing inhalation products, it's going to be relatively easy. You're just going to inhale a little bit more. If you're taking a tincture product, you're just going to slowly work up that dropper bottle. Whatever method it is, you'll just slowly increase that amount every few days until you find your comfortable spot, or the spot that provides you the best benefit with the least amount of side effects. So if you do happen to experience an adverse reaction, especially more so when we're using THC, it's just really important to understand that it will pass. The number one adverse experience that someone might have is feelings of panic or feelings of anxiety. And for a lot of us, when we're new to cannabis, it's a function of just not being familiar with the experience or what it feels like. So the more that you can tell yourself that no one's ever died from cannabis, you will be just fine, you will get through it, get yourself to do whatever stress relieving things typically work for you, you will get through it just fine. You can also add in some CBD to counteract some of that effect. But if you go low and slow, hopefully we can avoid that experience altogether. So next I'm going to cover some of my biggest tips for dosing as a cannabis patient. You can guess the first one. I'm going to say it again. It's to go low and slow. Number one rule, it could just be the only rule, go low and slow. Number two tip is to figure out your ratio. We have other videos that talked about this on the THC versus CBD, really taking some time to experiment with different products, figure out what ratio works best for each symptom. I have ratios that work best for my GI symptoms and ratios that work best for my pain, and then I'll use just a straight THC product with no CBD for sleep because that's what works best there. It might look different for each symptom, so it might take some experimentation if you have different things that you're working with to really hone it in and figure it out. But I cannot stress, again, low and slow, and do not overlook CBD. It's about that ratio, not about one or the other. The next tip is to take multiple small doses over the course of the day instead of just 1 or 2 big doses. This is a concept that we call microdosing, and this helps to provide that stability that I've talked a lot about. If you can dose smaller throughout the day more consistently, most patients will find that they're really able to reduce the severity of their symptoms and the frequency of any flare-ups or spikes. So dosing lower, more consistently throughout the day typically works far better than just big doses trying to just overdo it all at once. My next tip is to use the same dose and the same delivery method multiple days in a row. That's why I said don't increase your dose until about 3 days in. Especially important as a new patient. When you're brand new to cannabis, you might not feel anything your first couple doses, and that's because essentially your endocannabinoid system is turning on and it's lighting up. It's just starting to realize that there's something there to respond to. So don't go too quickly. Give it a couple days of that same consistent dose before upping it and trying that next step. If after a few days you don't feel any different or you don't think it's working, then go ahead and increase it and start working your way up. My next tip is to dose with intention. And this isn't always my most well-received tip, especially to those of you that are coming into this with a lot of cannabis experience. When I became a cannabis patient, I had been using cannabis for probably over a decade, if I do the math. I don't want to. But I've been using it for a really long time, and I came into it with that I know what I'm doing kind of attitude, and THC is what it's about kind of attitude. And it's very easy when you have this and you've been using cannabis for a long time to start to just escape from your symptoms and not necessarily treat your symptoms. And there's certainly a role for that, but it has its time and place. So you can think about this in kind of 3 different ways. You have medicinal use, you have medicinal escape, and then you have escape. Medicinal use is really intentional. You're picking a specific symptom and dosing for that symptom and have a lot of intention behind what you're doing in each moment. Medicinal escape is escaping with intention. I've had a really stressful long day at work and I really need to just relax and check out and bring my anxiety down. That's medicinal escape. But then we have cannabis use that just becomes escape. And that's when we're just using because we feel like it and not really even paying attention to what we're using or why or what symptom we're treating. So as you start to use cannabis, really make this at your forefront. Before you take a dose, know exactly why you're taking that dose. Because cannabis naturally has that psychoactivity and that high, it's just easy to check out. And that leads to an increased tolerance. That leads to the medicine not working as effective. So just keep that intention with you and it can go a really long way. And then my last tip for dosing cannabis is understanding the biphasic response. Now, this means that what works at a low or moderate dose to alleviate a symptom can actually trigger that symptom at a high dose. Now, I'll use anxiety as an example. At low to moderate doses of THC, cannabis can be really effective for anxiety and reducing it down and bringing it down. But for a lot of people, if they take in too much THC, the first thing they experience is panic and anxiety and paranoia. The same thing can happen with nausea. Low to moderate doses of THC in cannabis can be really effective for reducing nausea, but if you happen to eat too much cannabis, you will probably get nauseous and dizzy. So biphasic, meaning the things that cannabis works really well for at a low dose can have an opposite reaction at a high dose. So this is another reason why it's really important to keep your dosing low and slow and only increase when absolutely necessary. Because once you hit that point, cannabis is certainly not going to help you. It can actually cause the symptoms that you were trying to treat in the first place. So I know that all of this can feel like a lot. It's a lot to learn and a lot to take in. But cannabis is really forgiving. And what I mean by that is even if you don't take what probably will work best for you, it's probably still going to help just a little bit. So all you can do is tune into your body, learn as much as you can, and keep at it. As always, if you have any questions with your cannabis care, reach out to us. Our patient care team will always be happy to assist, especially getting you dialed in on your dosing.